I am well rooted in Georgia. On both sides of my family, everyone has lived, was born, lived, and died in Georgia since the 18th century. So, and both my great-grandfather and my grandfather were doctors, were country doctors who did surgery in Statesboro, and they had the Floyd Sanatorium in Statesboro. And my dad, who went to Johns Hopkins Medical School and got very good orthopedic training, wanted to be in a larger community than Statesboro because there were very few orthopedic surgeons in the state when he went into practice. So he established what became OrthoGeorgia in 1961. I grew up with my dad's training, with my dad being an orthopedic surgeon, with this medical family legacy. So I really thought hard about what I wanted to do, and I decided that if I was going into medicine, I wanted to be the best at what I did. And so I stayed in Georgia for medical school. I went to Emory to medical school, and then went up on the East Coast and got the best training that I think was available in the world at that time. And then after 18 years away, I came back to Georgia. I came back to Macon. I had wonderful opportunities to teach at Harvard, to teach at Emory, but I wanted to come home. And I've never looked back. I've never regretted it. I was able to really come to what then was the pioneer, was the frontier in hand surgery, because there was nobody else really doing contemporary hand surgery, particularly for acute trauma at that time. My dad did great hand surgery, and I don't want to take anything away from him, but the hand microsurgical training and a lot of the new techniques and being available 24/7 is what I did when I came back in 1987, and just never looked back after that. I came home and I was able to take care of my people, so to speak. Obviously, I had a congenital interest. I'm a fourth generation, and now my son's a doctor, so he's fifth generation. But I had to make the decision that I wanted to become a medical doctor, but I wanted to stand on my own training and education. So after I became a medical doctor, I really knew that I wanted to be a surgeon, and for a while I flirted with the idea of being a cardiac surgeon. I worked for cardiac surgeons here in Macon. I did cardiac surgical rotations at Emory, but during that time in the late 70s, microvascular surgery and microsurgery and a lot of new things were happening in hand surgery, replantation, toe-to-thumb transplants, and it was really intriguing and interested me, and it was a specialty where you could take care of multiple organs. You could take care of the skin, blood vessels, nerves, bone, and tendon, and so that was very challenging and interesting to me. So I decided I wanted to get the best training in hand surgery that I could, and so I set about doing that. Hand surgery really became a specialty out of World War II, because to do hand surgery, you have to be able to do plastic surgical techniques, orthopedic surgical techniques, neurosurgical techniques, and vascular surgical techniques. I did 2 years of general surgery training. So I learned a lot of patient care. I learned a lot of vascular surgical techniques, which I would later use in hand surgery. And then and that was at Johns Hopkins Hospital in Baltimore. And then I did an orthopedic residency at Harvard, and I was chief resident at the Massachusetts General Hospital in orthopedic surgery. But at that time, the hand fellowship and the hand residency opportunities, the opportunities for a resident at the Mass General in hand surgery were just great. Seminal work was being done there. And I trained with a gentleman, Dr. Richard Smith, who unfortunately died young of a brain tumor, but I really had great training and great exposure to hand surgery there. I was fortunate, one of the founders of the Hand Society and one of the great hand surgeons that came out of the Second World War was a man named Bill Littler, who was both an artist and a hand surgeon, very innovative, and he was able to demonstrate his operations and his invention, so to speak, his conception, his conceptual reality of hand surgery with drawing. And he could teach and draw, and basically then you go in and do the surgery. And he basically devised a lot of surgery. So that was really a final polishing and training in hand surgery. So I think the fellowship for me, and frankly for everyone who goes into hand surgery, a fellowship really gives you the opportunity, gives the young surgeon the opportunity to expand as a hand surgeon, to learn techniques, and to really focus on that specialty. The certificate of added qualification in hand surgery, I mentioned Dr. Smith at the Mass General earlier, who I trained with. While I was training with him, he and a couple of other prominent hand surgeons around the country really helped develop the certificate of added qualification that the three subspecialty boards, the American Board of Surgery, which is general surgery, American Board of Plastic and Reconstructive Surgery, and the American Board of Orthopaedic Surgery, all began in the late 80s to offer, or maybe around 1990, to offer a certificate of added qualification in hand surgery. And now to sit for that exam, you need to be trained in one of those basic subspecialties or specialties, those three specialties, pass the boards in those specialties, have done a hand fellowship, have your practice monitored and evaluated by the board, and also be evaluated by your peers around the country, and pass an examination that now we take every 10 years. At one time, when I first came back to Macon, I was the only hand microsurgeon between Atlanta and Gainesville, Florida, and the practice sort of congealed around that. So and I think it's pretty well known that you'd have to go a ways to find better hand surgeons than we are, and I think we really are as good as any hand center in the nation.